Hey folks, so welcome back. So we're starting week 2 of our research methods course. So this week we'll be talking about planning research. So that includes methodology, that includes sampling, and then we're also going to talk about validity and reliability. So just to start out with a recap of what we covered in week 1. So we talked about constructs, operational definitions, and then creating variables from those constructs and definitions. And so to give an example of kind of an overview, we talked about that a construct could be something broad and abstract, like depression. We could operationalize that as how the DSM defines major depressive disorder, so the criteria in the DSM. And then we could use a variable such as the Beck Depression Inventory to measure that construct. We also talked about experimental versus observational research designs. So if you remember experimental, that involves manipulating conditions and variables. Typically, we use the terminology independent variable, which is the variable that we are manipulating. The dependent variable, which is the variable that we expect to be affected by the independent variable. And then typically there's a control group. So a group that we do not apply the independent variable to so that we can compare. And then in observational research designs, we're simply observing conditions. So this does not involve manipulation. And in this case, we have a predictor variable, and that's the variable we think has an effect on an outcome. And then we have the outcome or response variable, which is the variable we expect to be the outcome. So this week, let's talk about the methodology or the how to conduct research. And I want you all to remember that there's no perfect research design. When we get into sampling, that's true of sampling as well, but each design has its pros and cons. Each design also has what we refer to as threats to validity, or in other words, how good or how true is the information that we learn based on our research design. So let's start off by talking about a quasi-experimental design. So this is similar to an experimental design. However, there's some differences. So participants are not randomly selected and assigned to groups. There's usually no control group. The researcher is manipulating a condition or adding an intervention and then observing its effects. And it's considered to be not as rigorous as a true experimental design that has a control group and that is more experimental, more scientific. So there's an article that was posted to the module this week talking about internet cessation program, smoking cessation program, and it was a pilot study that was done. And this is a great example of a quasi-experimental design. So the researchers looked at a population of adult smokers who had some intention to quit. They ended up with 45 individuals who participated in the intervention. They had only 26 people follow up afterward to get a sense of what the outcome was. And the researchers said that about a third had either quit or reduced their tobacco use by at least 50%. So thinking about a design like this and having read the research article or skimmed it or reviewed it, what do you think are the strengths of this kind of research design? And what are the weaknesses? So let's talk about some disadvantages. So this study had a small sample size. When a sample size is small, it's hard to draw conclusions about the research. Is it a fluke that these findings were seen in this small sample? There was also no control group, so it's not possible to know whether it was the intervention or some other variable that had an effect on the participants quitting or reducing their smoking. Was there some other characteristic about the group that quit that caused them to be successful? For example, was that group more motivated to quit and therefore more likely to be successful with any intervention? Was the group that followed up different than the participants who never followed up? And was there something about the group that was not successful? For example, were they less motivated? Were there other life stressors or variables that the study did not capture? Then we have a correlational research design. So this design seeks to assess for relationships among one or more variables. And this is measuring variables without manipulation. It allows the researcher to examine naturally occurring relationships, but it's difficult to determine what other variables may play a role if a relationship exists. Then there's archival research. So this is looking at records or information that already exists, such as databases, medical records, things of that nature. It's usually exempt from institutional review board approval or an ethics board approval if the information is de-identified. So if there's no names, birth dates, addresses, or if the information is public record. So this makes it a little bit easier to use archival data if those conditions apply. The disadvantages is that there's no way of knowing if the quality of the information is any good. If other people gather the information, they were probably gathering it for purposes other than for your research question. If we're looking at, for example, behaviors in an inpatient hospital, there's the potential that certain staff members maybe had a bias. So maybe they wrote more incidents or infracted the patients more often if they didn't like the patient. And then, of course, we don't know if there's any missing information when we're using archival records. Then we have case studies. So these involve an in-depth study of one individual or of a few select individuals. An advantage to this approach is that it takes into account unique characteristics or rare circumstances in those individuals. And a disadvantage is that it's unlikely to be generalizable. So in other words, the observations that are seen in these special individuals might not apply to other individuals from that population. In a longitudinal research design, this looks at a group of people using repeated measures or check-ins periodically to examine changes or progressions. And so there was a TED Talk that was posted this week regarding the Harvard Life Expectancy or Adult Development Study. And so this study looked at hundreds of men. I believe they added women later, but when it began, it was men over their lifetime to examine factors which improve life expectancy, satisfaction. I think they looked at a few different variables. And I think they looked at males who are college educated, I think Harvard attendees, and then males from less or disadvantaged populations that had more of a rough upbringing, to look at kind of differences between those groups. And the advantages here is that it provides objective information in vivo rather than relying on participants' memory. So rather than asking a 70-year-old man, think about when you were 23, reflect back on that time and fill out this questionnaire, the information that's gathered is going to be more accurate. It's going to be less influenced by the person's memory and those limitations. In terms of disadvantages, these studies are typically expensive. This is a very special study. It was written about a lot. There's a whole website dedicated to this this project, and it's rare because it is expensive. It's difficult to fund. Typically, there's a lot of a high dropout rate for participants. And then if the head researcher retires, if they die, it's hard to continue that research with a new group of researchers. Then we have qualitative research, and the text doesn't talk too much about this type of research, but this is a type of research that's employed frequently in clinical psychology programs for dissertations and whatnot. Essentially, this gathers information about qualities of a population and/or their experiences. So the advantages here is that it allows for a holistic perspective, identifying common themes. It does not require the researcher to use or interpret statistical analyses. And there are some disadvantages. So usually this is very time consuming. It typically involves conducting interviews, recording those interviews, transcribing them, and then coding that information into various themes or sections. And there are some criticisms that it's not as scientifically rigorous and that it can be more subjective because of the design of the research. So there was another example that was posted to this week's module about qualitative study of healthcare workers and experiences during the early surges in the COVID-19 pandemic. And so in this study, they looked at 22 healthcare workers in, I believe it was New England or Massachusetts. They applied a social ecological model to help kind of guide their research question. So to develop their interviews that they used and then to organize their interview questions. And some of the major themes that they found, they had institutions, infrastructure, and the pandemic, working under fire, the political becomes the personal, and then hope. So the findings provided some insight into mechanisms that could improve healthcare workers' mental health, which is kind of a unique and helpful contribution. And of course, the limitations were that it was a small sample because of the design, the qualitative design. And also it was geographically limited. So would this information necessarily apply to healthcare workers in other regions in the United States? Right. So think about as we finish this lecture. So applying to your research ideas. So what designs do you think would work best to answer your hypothetical research question? What are the strengths and limitations? And what designs do you think would not work to answer your research question or you would want to avoid? So thinking about those things as you start your sources worksheet this week. Thanks.